There are over 200 types of cancer. Breast cancer is the fourth common cancer in the U.S. today. It is also the second deadliest cancer among women, lacking only the lung cancer. Over the course of a lifetime, 1 in every 8 women will develop breast cancer, while only 1 in every 100,000 men will get it. In both men and women, the risk for breast cancer increases with age of the individual. There are a great number of things that can contribute to the likelihood of developing breast cancer, as well as precautions one can take to lower that likelihood. Lowering the chances, people should maintain a healthy diet, not smoke, limit or eliminate alcohol intake, exercise regularly, and basically keep the body as strong and functional as possible. Regular self-breast examinations are recommended for everyone, as they can reveal a lump or mass, and early detection is critical in breast cancer. The earlier the tumor is found, the less harmful it can be to the body. Breast cancer is a result of mutation in genes tasked with regulating the growth of cells. These genes are also meant to keep the cells healthy. Without these genes to regulate these cells, the mutated cells can divide and multiply, causing tumor to form. There are different types of tumors. Benign tumors are not dangerous to a person, whereas malignant tumors are cancerous and can spread to other types in the body. Breast cancer is not to be taken lightly, and it is important to know the risks and possibilities of infection at the early age so that one can take necessary precautions to lower these. Occurs as a result of mutations or normal changes in genes responsible for regulating the growth of cells and keeping them healthy. The genes are in each cell nucleus, which acts as a control room for each cell. Normally, the cells in our bodies replace themselves through an orderly process of self-growth. Healthy cells take over as old cells die out, but over time mutations can turn on certain genes and turn off others in a cell. That changed cell gains the ability to keep dividing without control or order, producing more cells. A tumor can begin not dangerous to health or malignant, has the potential to be dangerous. Benign tumors are not considered cancerous. Their cells are close to normal in appearance. They grow slowly and they do not invade nearby tissues or spread to other parts of the body. Malignant tumors are cancerous. Left untreated, malignant cells eventually can spread beyond the original tumor to other body parts, like it and forming a tumor. Usually, breast cancer either begins in the cells of the lobules, which are milk-producing glands, or the ducts, the passage that drain milk from the lobules to the nipple. Less commonly, breast cancer can begin in the stromal tissues, which include the fatty and fibrous connective tissues of the breast. Though boys and girls begin life with similar breast tissues, over time men do not have the same complex breast growth and development as women. At puberty, high testosterone and low estrogen levels stop breast developing in males. Some milk ducts exist, but they remain undeveloped, and the lobules are most often absent. However, breast production, including breast problems, including breast cancer, can occur in men. Breast cancer in men is rare, but it does happen in the U.S. About 1% of all breast cancer cases occur in men. In 2014, it is estimated that among men in the U.S. there will be 2,360 new cases of invasive breast cancer, includes new cases of primary breast cancer among survivors, but not Rec- Recurrence of original breast cancer among survivors. 430 breast cancer deaths of breast cancer incidence. New cases and mortality death are much lower among men than women. A widespread use of screening mammograms have increased the number of breast cancers found before they cause any symptoms. Still, some breast cancers are not found by mammograms, either because the test was not done or because even under ideal conditions, mammograms do not find every breast cancer. The common symptom of breast cancer is a new lump or mass. A mass is painless, hard, and has irregular edges. It is more likely to be cancerous, but breast cancers can be tender, soft, or rounded. They can even be painful. For this reason, it is important to have any new breast mass or lump or breast charge checked by a healthcare professional experienced in diagnosing breast diseases. Other possible signs of breast cancer are swelling of all part of a breast, even if no distinct lump is felt. Skin irrational or dimpling, breast or nipple pain, nipple retraction, turning inward, redness, scaliness, or thickness of the nipple or breast skin. A nipple discharge other than milk breast. Sometimes a breast cancer can spread to lymph nodes under the arm or around the collarbone and cause a lump or swelling there, even before the original tumor in the breast tissue is large enough to be felt. Although any of these symptoms can be caused by things other than breast cancer, if you have them, they should be reported to your doctor so he or she can find the cause. Some diagnosis tests for breast cancer are breast self-examine. A breast self-examine is an examination of the breast for changes or abnormalities. A self-breast examine should be performed monthly, and any change or abnormality should be discussed with your doctor or physician for more information about how to perform a self-breast examination. Clinical breast examine. A clinical breast examine is an exam performed by a qualified nurse or doctor. They will check for lump or other physical changes in the breast. The goal is to detect breast cancer in the earliest stages, either by evaluating the patient's symptoms or finding breast abnormalities. Having a regularly scheduled mammogram. The standard diagnostic scan is especially important. A mammogram is an X-ray. The breast is exposed to a small dose of ionizing radiation that produces an image of the breast tissue. If your mammogram or a clinical exam detects a suspicious site, further investigation is always necessary. Although lumps are usually non-cancerous, the only way to be certain is to obtain additional tests such as ultrasound. If the solid mass appearance of the ultrasound, your radiologist may recommend a biopsy, a procedure in which cells are removed from a suspicious area to check for the prevalence of cancer. There are ways to treat and reduce the spreading of cancer throughout body. Types of cancer treatment such as surgery, chemotherapy, radiation therapy are the more common treatments. Surgery can be used to diagnose, treat, or even help prevent cancer in some cases. Most people with cancer will have some type of surgery, if often offers the greatest chance of cure, especially if the cancer has not spread to other body parts. Chemotherapy is the use of medicines or drugs to treat cancer. The thought of having chemotherapy frightens many people, but knowing what chemotherapy is, how it works, and what to expect can often help calm your fears. It can also give you a better sense of control over your cancer treatment. Radiation therapy uses high energy particles or wave to destroy or change or damage cancer cells. It is one of the most common treatments of cancer, either by itself or along with other forms of treatment. Other treatment types are sentinel lymph node biopsy, hormone treatment, targeted treatment. Sentinel lymph node biopsy is the removal of sentinel lymph node during surgery. The sentinel lymph node is the first lymph node to receive lymphatic discharge from the tumor. It is the first lymph node the cancer is likely to spread to from a tumor. A radioactive substance or blue dye is injected near the tumor. The substance or dye flows through the lymph ducts to the lymph nodes. The first lymph node to receive the substance or dye is removed. A pathologist views the tissue with a microscope to look for cancer cells. If cancer cells are not found, it may not be necessary to remove the lymph nodes. After the sentinel lymph node biopsy, the surgeon removes the tumor, breast-conserving surgery or mastectomy. Hormone therapy is a cancer treatment that removes hormones or blocks their action and stops cancer cells from growing. Hormones are a substance made by glands in the body and circulated in the bloodstreams. Some hormones can cause certain cancers to grow. If tests show that the cancer cells have place where hormones can attack receptors, drugs, surgery, or radiation therapy used to reduce the production of hormones or block them working. The hormone estrogen, which makes some breast cancer grow, is made mainly by the ovaries. Treatment to stop the ovaries making estrogen is called ovarian ablation. Targeted therapy is a type of therapy that uses drugs or other substances to identify and attack specific cancer cells without harming normal cells. Monoclonal antibodies and tyrosine kinase inhibitors are two types of targeted therapies used in the treatment of breast cancer. PARP inhibitors are types of targeted therapy being studied for the treatment of triple negative breast cancer. Breast cancer is a very complex disease. The different types that invade different parts of the breast, as well as benign and malignant tumors. Some are harmful while others are not. However, none should be forgotten or not monitored regularly. Women should be very vigilant in their breast examinations and do them frequently. Men have lesser chance of developing breast cancer, but should still be cautious. One of the best things to hope for when diagnosed with breast cancer is early detection. Early detection can prevent invasive as well as chemotherapy or other forms of treatment that may affect other areas of the body. Although breast cancer is not the most common type in the USA, it is one of the leading terminal cancers.